And we're going to move on to a talk with Shawn Buckley in the Buckley Unfiltered segment. Shawn, what are you going to talk to us about today?
Well, I'm going to talk about censorship. Or maybe I shouldn't. Maybe I should just shut up, right? So, but you know, it's if you were in charge of health policy, so just put yourself in that position. So you're in charge of Canada's health policy. Do you think you're going to get better health outcomes by allowing people to access truthful health information? Or are you going to get better health outcomes by censoring truthful health information? And we're not talking about fraud here. We've got fraud provisions in the Food and Drug Act, Section 9. We've got fraud provisions in our criminal code. We've got fraud provisions in our telecommunications legislation. We're not talking about people lying. We're talking about truthful health information, and it's a really valid question, and it's a question we need to be asking ourselves, because I think most of us would be absolutely shocked when we understand that it's basically illegal. We've criminalized Canadians having access to truthful health information, and I'm not kidding. So we've got Health Canada, which regulates, basically anything that we're using for a therapeutic purpose. So we've defined drugs so broadly that it covers things as benign as ginger tea and things, as dangerous as chemicals that will only allow, a small number of terminal patients to take because they're so toxic. Like that whole spectrum are drugs. And Health Canada has taken the position that you cannot share. So anyone involved in the drug industry, which are those that would share, they'll have the information. And in many cases, they're the only ones that have the information. And they're the ones that, at least in the natural health community, would want to share the information. The drug community, the chemical drug community, largely has an interest in not sharing truthful health information. But they're the only ones that by and large have the information or have an interest in sharing the information. So Health Canada takes the position, no, anyone involved in the drug industry can't share anything except what we call the label claim. And just to explain, so you can't sell anything without Health Canada's approval, because we live in a country where it is illegal to treat ourselves with anything the government doesn't approve of. So if Big Brother has not said that we can use something to either stay healthy or to recover from, sickness, if Big Brother hasn't said we can, then we can't. So that's our starting legal framework, is all treatments are illegal, and then Health Canada grants exemptions to this blanket, all treatments are illegal, in the form of licenses. Now, when Health Canada grants a license, the license will be for a specific thing, and that's the label claim. Now, curiously, is for chemical drugs, Health Canada is usually very specific. So Health Canada will grant a license for depression. So you can use the chemical drug if it's licensed for depression to treat depression. But all you can say is it's for depression. Now, with natural health products, and this is its own special form of censorship, so even though the natural health product regulations don't say that you can't license them for specific things, Health Canada's just taken the policy position, we're not going to license you for specific things. We're just going to let you make what's called structure function claims. So you could have a product that's better at treating depression than any chemical drug, but you're going to be licensed for something like supports central nervous system, a structure function claim. And in that case, you are limited to just that claim. So just so that everyone understands, so you get a license for a specific condition. such as depression or supports central nervous system. And then Health Canada takes the position that is the only thing you can say. Can't say anything else. Now, this censorship, it serves the chemical drug industry very well. And I'll just use the depression example that I've just given. So, a chemical drug, you could get licensed for depression. I was cross-examining a drug approval expert in a Health Canada court case. And this expert, all that this person does is get psychiatric drugs like antidepressants, approved of by Health Canada. And under oath, this person starts complaining to me and how difficult it is to get a new antidepressant approved, because you have to give Health Canada 2 double-blind clinical trials showing the drug works, which just means there's a statistical separation between the drug and the sugar pill placebo, and we pretend that means it works. But this person's complaining, well, I got to give Health Canada 2. But to get that 2, I've learned that I've got to run at least 8. So right out of the gate, I don't wait. I don't run 2 because that's going to take too long. I run 8. And out of those 8, I'll get 2. And I'll give those to Health Canada. Well, let's say you're a citizen and you're trying to make a decision. One of your children has depression and the doctor's recommending that you take this antidepressant. Do you think it might help you in making an informed health decision for your child to know that 8 double-blind clinical trials were run, 6 showed it didn't work at all, the sugar pill outperformed, but 2 showed it worked better? Don't you think you should have that information? But you're not even going to see those 2, because then you could see that the study was designed to basically get the outcome they wanted. If you were shown all 8, you'd just be, what? You mean they designed a study to basically give them a specific result, and even then it took 8 to get 2? So the drug company can't share that information with you. Health Canada won't let them share the clinical trial evidence, the good, bad, or the ugly. And generally speaking, that serves the chemical drug industry extremely well. Could you imagine if they had to share their animal safety studies and, their life, death, 50 studies and stuff like that with us? It would be quite spectacular. So let's turn to the natural health industry, because there's kind of the opposite there, is in the area of natural health, because things that we eat that we happen to be using for medicine also tend not to kill us. In fact, they're so incredibly safe, we're not worried about that. We actually want to share truthful health information, and I'll use the depression thing, and I'll just turn that around. So, everyone knows I was counsel for True Hope Nutritional Support, and Health Canada actually charged them, and the court acquitted them, saying, well, thank goodness, or more people would have died. Like literally, it was a life and death situation where the court found as a fact that Health Canada had killed people by restricting access to the product. But when they started, they didn't have clinical trial evidence. They basically just had example after example after example of people that had failed and were literally serving a death sentence on the Health Canada approved chemicals, who had turned to the product and their lives were turned around. And that's what would, those were the people that were being attracted at the beginning, but they're being told the absolute truth. Here's the evidence we have. Here's what we don't have. In fact, you're the beginning of the evidence, because we're only going to let you come aboard if we can track your symptoms and learn about this. And these people chose to do that. But now I think there's like over 30 peer-reviewed journal publications, all funded by governments around the world. So, none funded by True Hope. So here we have governments around the world that, decided that it was in the public interest to use public funds to fund research. I mean, I live in Alberta. The Alberta government coughed up a big whack of dough to run a double-blind clinical trial through Children's Hospital at the Behavioral Research Unit. Like, governments get involved here. So this is government-funded research, then peer-reviewed and published in journals, and some of them, like keynote journals, like the Journal of Psychiatry, the Journal of Child and Adolescent Psychopharmacology. Well, it's illegal for True Hope to share that with you. Can I just say that again? So Health Canada would go after True Hope. It's illegal for them to share government-funded research with you. Well, that's a little interesting, isn't it? So how are you supposed to make informed health decisions for both yourself or your family if actually all that you can be told is antidepressant or support central nervous system? Well, you can't. So what's going on here? Like, who does this serve? It serves the government-funded chemical drug medical system. So, we've got the Canada Health Plan, which basically provinces are obligated to accept the money. Like, there's just the federal government sucks so much money out of the provinces and then says, here, I'll give it back, but only if you follow the Canada Health Plan, which obligates them to provide chemical drug medical care. It obligates them, and it has to be free. And we're moving to where the chemical drugs themselves, when they're not provided to you within the hospital system, are also free. So it serves that system because we support that system because we've been led to believe by Health Canada itself that, well, all these drugs that they approve are safe and effective. But let's have complete censorship so that we can't decide for ourselves whether they're safe or effective. And at the same time, this censorship acts against the natural health medical system, which is citizen funded. We have to pay for it ourselves. We have to pay for access to natural health practitioners. We have to pay for our natural health products ourselves. And to keep us from competing, we're not allowed to tell the truth about what's going on so that you can't make good health decisions. Now, are you free? Are you really free to ensure that you're healthy if you actually can't be told about truthful health information? How do you make informed health decisions? How do you not basically be completely dependent on healthcare practitioners to make decisions for you? It's just, it's truly a life and death question. And I don't think there's a country in the world that is more censored than Canada. I don't think we can find any example in history of any people that have been so censored concerning truthful health information as us. And yet, we believe that we're free. It's actually quite funny and pathetic in a way. So, and now we have the risk of, health food stores being shut down over this censorship issue. So what's happened in the last, year and a half is in the 2023 federal budget, the Health Canada snuck in some changes to the Food and Drug Act because they knew they had to do it in a sneaky way. If they actually had the government introduce a bill to do this and it got focused on it, there's no way it would pass. So they sneak it into the budget where they basically move natural health products into the same class of drugs as prescription chemicals. Now, this gave Health Canada a whole bunch of powers, but the scary thing is it also increased the penalties. So before that, because we're so low risk, our maximum fine for, violation was $5,000. Now, you could go to jail for several years. It's not like there weren't teeth, And if you hurt somebody, you could be, facing criminal negligence causing bodily harm or death, and face life imprisonment and basically unlimited fines. So it's not like there weren't things to keep people in check. But under the Food and Drug Act, we dealing with Health Canada for regulatory violations that have no health consequence at all, there was a limit of a $5,000 per offense fine. Now it's $5 million per day of offense. And those types of fines are made for big drug companies like Pfizer, where arguably $5 million a day isn't even pocket change. But I don't know of a natural health product company or a natural health practitioner that could withstand half of that. And, whenever anyone's charged, and I mean, I've been in court defending charges from Health Canada against natural health product companies, personally, more than all other Canadian lawyers combined. I mean, and they just lay charge after charge after charge. So, so we're in this place where we've got these crazy fines. And then in the last budget bill, the 2024 budget bill, there's changes to the Food and Drug Act, which give the minister the power to basically make it an offense, to promote off-label use. Well, off-label use is anything beyond that label claim. And for most natural health products, the label claim is so limited that almost 100% of our use is off-label use. Now, if you go to a health food store, and I'll use my wife as an example. So she went to a health food store because she was having migraines, and the store person who was trained suggested that she uses some B-complex vitamins and a certain type of magnesium. And it's proven to be tremendously effective for her. Well, the minister could just basically now make an order saying it's illegal to promote the off-label use of natural health products. Now that's a $5 million a day offense. It's an offense even without this off-label use, according to Health Canada. And we've heard rumors of them sending undercover inspectors into health food stores. And if anyone's aware of that happening, please put us in contact with the stores. But what would happen to our access to natural health products in a meaningful way, like knowing what to take them for, if stores got frightened into the situation where they're not going to share truthful health information with us? Like, I'm not talking about, one-on-one patient doctor, like you go to your naturopathic doctor or a nutritionist. But a lot of us rely on the expertise at health food stores, to get advice on these products. And what will happen to those stores and to our access to these stores if we can't do that anymore? And I'll just stop there. But Jason, that's what I wanted to talk about, was just this censorship issue, because it's really frightening. These changes are deliberate.
That's when it really gets scary.
And Eisenhower, who said, nothing in government happens by accident. It's deliberate. They moved us into the therapeutic product category so that they would have a big hammer that would intimidate us and threaten us over minor regulatory violations that have no health consequence, such as sharing truthful health information. Because as I said, if you actually did something that harmed somebody, so let's say you had adulterated natural health product and somebody got hurt, you're not worried about the Food and Drug Act. You're worried about the criminal code and life imprisonment. You're worried about, unlimited fines under the criminal code. So when we're complaining about moving us to these $5 million a day fines, we're complaining about them applying for every offense. So any violation of the act or the regulations, however minor, and even if it was to get good health outcomes, because the problem I have as a lawyer is I've had clients defy Health Canada because it was necessary for them to protect health. And, I've used True Hope as an example where the court found there would have actually been deaths. But I also use the example of a company that refused to recall natokinase on the advice of a risk analysis medical doctor that the company hired to say, what do we do here, when Health Canada was shamefully recalling natokinase off of the Canadian market for a period of time. So, I've been in the situation, like as a lawyer, when a client comes to me and says, Health Canada is demanding I recall a product, the first question I used to ask is this essential for health? Like, does anyone's life depend on it? Or like, would there be people that truly suffer if you withdraw? No, I asked that question because under our criminal code, you can't put a product on the market, a health product, have people come to rely on it for their health, or well-being, and then pull it from the market. That's criminal negligence causing bodily harm and or death. And I'm actually, as a lawyer, wanting to protect them from some serious consequences, and also doing something morally shameful and reprehensible, and where you should be charged criminally. But that's what Health Canada is demanding. And before, it wasn't a problem. That'd be the only question I'd ask. But now I'd have to ask that question, and then also say, who's going to provide that product when your company's gone? Because now you'll be completely destroyed. You can't stand up against Health Canada, even if they're requiring you to act criminally and to kill people, because that's never an issue.
And we end up with like one factory making pills, one company owning all of the quote unquote natural health retailers, one company owning the manufacturers, all going to one factory that's got enough money and enough pull with the government to get their stuff approved through Health Canada. Sounds like a coincidence to me.
Well, you're touching on a different topic, but it's an important one, and it's the centralization. So before the natural health product regulations, we tended to be smaller companies. We tended to, have a whole bunch of people that did their own manufacturing, and we had way more innovation. But the regulations impose such a burden, and I'll just, for those of you who aren't familiar with, what's happened, is we didn't need government pre-approval before to sell ginger tea to treat nausea. We've been doing it for 3,000 years. Why all of a sudden do we have to get government pre-approval and go through this very expensive and onerous licensing system? And, our brothers and sisters south of the border in the United States, they don't. Their food's there. They're deemed by law to be safe. You don't need government pre-approval. But all of a sudden here, Health Canada is imposing this on us. Well, we lost small players. One member who had served as a member on the NHPPA board for a while, he was a master herbalist. Well, he still is, but I don't think he's practicing anymore. And like when I say a master herbalist, I mean, it's like he was one of the top in Canada and very well respected. And he would go out, he would grow his own herbs, but he'd also go out into the wild and wild craft them. And I can tell you, and I used to use his products. I mean, if I had the choice today, I would want to use his products, but he had to go out of business because he was a small player and he couldn't withstand the regulatory burden. So here we lost, one of the top master herbalists in Canada who would grow his own herbs organically and wild craft. And we lost that. And it is truly a loss to Canadians like myself who would like to choose to access those products, but we no longer have a choice. And and I'm not anti good manufacturing practices and all of that, but let's not pretend that any of that was solved by the NHP regulations, because they won't. We basically moved us into a drug model where we deliberately overregulated. And so now we have large players. And we also used to be mainly just mom and pop health food stores. And, if one was really successful and opened another store and then another store and another store, now those chains have tended to have been purchased by larger players. And we just had CanPrev purchased by a pharmaceutical company. I think they were our second largest natural health product company. We've seen a lot of consolidation. And the culture's really changed. But I think, Jason, what you were alluding to is with this cost recovery that Health Canada is promising is going ahead this year, this calendar year. Like we're watching the Gazette daily, literally, to see when it's going to come in. Is they're going to be imposing fees for manufacturing. So for every building you manufacture in, every building you label in, a separate fee, every building you distribute from, a separate fee. If it's the same building, it just gets added on, these separate fees. It's going to push those manufacturers that are on the margin out of manufacturing. And then we're going to be in a situation where we have one or two large contract manufacturers doing all of the manufacturing. And we've already lost a lot of manufacturing expertise. Like, we should be doing whatever we can to push back to actually encouraging small manufacturers to start again. So we're going backwards, but it's part of this centralization. And I use the abattoirs as an example. It's about, a good 25 years ago, where we had small abattoirs everywhere. And then Health Canada and the Canadian Food Inspection Agency, our government, big brother in their wisdom, well, it's all by design, basically over-regulated the small abattoirs out of existence. And it had nothing to do with safety. I mean, I remember one call I got at my law firm, by these two gentlemen that ran a small abattoir. They both had master's degrees in running abattoirs from Europe. And it had nothing to do with safety. And, now we have to ship our animals large distances. And in the winter, it's just awfully cruel. And the whole experience for the animals is just atrocious. And it's not safe, but it allows the government to control the food supply. They can shut us down. They can require specific additives. They can do whatever they want. And so you basically lose freedom when the government can control your food and what you take as your medicine and has absolute control. And that's where we're moving in the area of medicines. We're largely there for the masses for food already.